everyone to this local outbreak engagement board, and particularly to members of the public who have joined us by streaming. I'm Hal Wollaston, Executive Portfolio Holder for Public Health and Community Wellbeing, Leisure and Culture, and Chairman of this board. I'll be assisted today by James Townsend as clerk for the meeting, by Kevin Griffin, who is the Zoom host. I will now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you. Do we have any apologies?
We have apologies from Shirose Claridge and Mandit Bilku.
Moving on then to the minutes of the previous meeting. I've been through them and can't see any problems, but I'd welcome any views from others. No, I'll take those as read in that case. In that case, we move on to declarations of interest. Again, I can't see any. In that case, we'll move speedily on to the situation report from Matt Pierce, please, and instance.
Evening, everyone. So, as always, I'm just going to take us through a few slides just showing the latest update in terms of COVID-19 in West Berkshire. So as always with these slides, just worth noting that the data may be a day behind in terms of the data that's just been released by the government today. So just do bear that in mind as I go through the slides. So as is a public meeting, just worth iterating that the national lockdown restrictions, as I'm sure many of you were aware, were lifted on the 2nd of December. In terms of how that applies to Berkshire, Slough is in tier 3, very high alert, and the rest of the local authorities across Berkshire are in tier 2, which includes West Berkshire. We know that these local alert levels will be reviewed every 2 weeks. So sometimes after the 14th of December, we expect to hear an update on whether we remain on tier 2 or whether we go down or up. And just to make the point, the alert levels are informed by a range of indicators. So much of the data you'll hear during my slides are informed by SAGE and utilised by the government and others to consider what levels each local authority go to, and that includes things such as incidence rates and NHS use. So in terms of the overall summary position, so we had 1,745 confirmed cases to date since the beginning of the pandemic. It's an overall very improved position to West Berkshire over the last couple of weeks, largely down to the national restrictions. So on this table, we just have each of the local authorities on the left-hand side. The first column talks about the individuals tested per 100,000. So West Berkshire currently testing around 281 people per 100,000 on the 7-day rolling average, slightly down. In terms of the positivity rate, so as you'll recall, this is the number of individuals that are tested positive as a proportion weekly. So West Berkshire's had a significant drop. We're now at 2.9%, which is really good. Anything lower than 5% is really positive. Slough, obviously, as we know, is in tier 3, so as we would expect, they have a higher positivity rate of 10, and the remaining local authorities around 5% mark, and the regional average around 5.5, and England of 6. Again, in cases per 100,000, again, West Berkshire, some really positive figures now, around 50.5 per 100,000. Which is a decrease on the week before. And again, this is significantly lower than all the local authorities across West Berkshire, clearly significantly lower than Slough, and significantly lower than the South East average of 144 and 149.5. So I think it's clearly the good work of all the residents in West Berkshire in terms of complying with that guidance, and we're seeing that in the data now, so that's a really good thing. In terms of the cases per 100,000 for 60 plus, so always make that point that this is a cohort we're particularly interested in, as we know older people are more susceptible in terms of the ill effects of COVID. So now that's it's 27.3 per 100,000. Again, so really good results and a decrease on the week before. And then in terms of the number of confirmed cases over the last 7 days, we're looking at 80. So this map, we would have seen it at many outbreak boards before. It's normally a lot darker blue in the previous iterations, but obviously now what we're seeing, apart from Reading, which is number 2 in the middle here, and then the boroughs on the fringes of London, most of our rates now between the 50 to 100,000 mark per week. So again, just reflecting that the clear impact that the national restrictions have had, and we're certainly heading in the right direction. And again, this graph just reiterates that from all the local authorities in Berkshire, West Berkshire to the left-hand side here. So the grey bar representing the England weekly incidence rate, the orange bar representing the regional southeast, and the blue bar representing the individual local authority. So again, West Berkshire clearly below both the regional and national average of the weekly incident rates. And again, you can just see why Slough is in tier 3, because their incident rate is a lot higher than both the regional and national average. In terms of the age groups, hasn't been massive amounts of significant change. So this is just the weekly change. We have the proportion of cases on the left-hand axis here, the y-axis, and on the x-axis we just got the week. And then each of the colours of these bars represent the age category. So the blue being less than 18, the maroon 18 to 34, 35 to 64 to green, and the amber 65 plus, and the unknown is just where we don't have that data. We tend to disregard this last bar chart because we're still waiting for that data to come through. So as you can see, it's kind of stayed relatively stable throughout the pandemic. There's the odd week where we had quite a high proportion of under 18s. There might be a slight reduction in the older age group, again, which is positive for West Berkshire. And then in terms of the deaths, again, obviously every death is...
Matt, sorry to interrupt you. Could you go back? Yeah, just a question around that, because obviously this is showing percentages within the cohort, but it's not showing the numbers, because the numbers are coming down, weekly cases coming down. So looking at for example, taking the 65 plus percentages and ignoring the last of those columns, we've got 20, 18, 16, 15, 14. So there's a decline there, but that is as a percentage of the total. So is it correct that, and I think we've seen this in the other charts, because the numbers are also coming down. In fact, the numbers of over 65s are narrowing even more than that would suggest, because the numbers are, total numbers are coming down, and the percentage of that total number is coming down as well.
Yes, I think we can infer from that as the numbers are coming down, that yeah, we can guess the proportion within those numbers are also coming down, if that makes sense. So yeah, this just shows the proportion within that week. It doesn't necessarily indicate the numbers, but yeah, you're right. We think the numbers of older people that are being infected are going down.
That's the thing I'm particularly interested in, is what is the true number of the older population within, and where is that trend going? And it looks like, I mean, in a sense, this is a positive. It's even more than the percentage change. It's positive.
So that, I mean, we got the number up here, haven't we? So we got the 80.
Right.
So of that 80, 14% of them were 65 or more. So about 40, so 50% of 40 of that 80 were between the age of 35 and 64.
Indeed. Yeah. Thank you, Matt.
So as I was saying, clearly every death is sad. We've had 2 deaths were recorded in the last week, and again we get a little bit delayed on this data. It's the 14th to 20th. Just want to make that point, and I think we sometimes do, is that obviously death isn't the only indicator in terms of the impact from the pandemic, and obviously long COVID is really important as well in terms of morbidity. So we don't yet have good data in terms of the impact on COVID in terms of long-term conditions and people having more long-term effects. And that's something we clearly need to keep an eye on going forward. And then in terms of the mortality in West Berkshire, so again, there does seem to be a slight upward trend here, but nothing significant. So the grey bar represents the average deaths that we would see in terms of a 5-year period. And if that bar goes above that grey line, then what we're seeing is significantly higher number of deaths during that particular month. But again, we don't necessarily know what the reason is for those higher number of deaths. It could be directly COVID related or non-directly COVID related. However, these small grey bars are the confidence intervals levels. So because those small lines don't go above this grey line, then we can't say for certain whether that is a statistically significant increase on those months. So we just need to keep a close eye on this over the weeks and months ahead. But as we can see, as we've discussed before, we're not seeing as higher rate, deaths as we did do during the first wave. Hospital activity, I'm not sure if Joe's going to give a quick update in terms of the CCG's position around COVID-19. Again, we can only report on the Berkshire Hospital data. Sorry, we can't report on the Berkshire Hospital data because that's not publicly available. But what we can report on is the South East Hospital admissions data. And on the 1st of December, there's just over 1,200 patients who are in hospital with COVID-19 in the South East, and 111 of these were on mechanical ventilation. As we can see on the top chart, which is the number of hospital admissions, you can start to see a slight downward trend. So again, that's really positive. And we obviously monitor that closely over the weeks and months ahead. In terms of the outbreaks, again, reflecting the numbers, we are seeing a reduction in the number of incidents and outbreaks. This just reports the last 7 days between the 30th and 6th of December. Just want to labour the point that these are just new incidents. We're still dealing with many existing exposures, clusters and outbreaks. So an outbreak can be defined as anything occurring within the last 28 days. And we are certainly dealing with a lot more than that's reflected on here. So we've certainly seen a reduction in the number of incidents in schools. And again, we're working hard with our education team to support them. But again, it's looking more favourable. And not all the incidents always get reported through to the local authorities. There might be many that we're not aware of, single staff getting COVID-19 within their workplace, for example. And then in terms of West Berkshire, the number just reflected in the wards. So these are the wards data. To the east of the district, a slightly higher proportion of cases. But again, we're not really seeing any significant community transmission or any clear links between a number of these cases. As we know, a lot of COVID is asymptomatic, but an improving picture. Many of those wards are white, which can indicate none or cases less than 5. So in summary, restrictions lifted on 2nd December, West Berkshire's in tier 2. We've had 1,745 confirmed cases so far, 80 of these within the last 7 days. The weekly rate, much improved position of 50.5 per 100,000 population. Really important to make that point that clearly we're entering a difficult season in terms of the festive season, and we just need to make sure we comply as best we can with the national restrictions. And then the rates for the over 60 has decreased in the last week to 27.3 per 100,000. And sadly, there's been 144 COVID-related deaths to date. So as always, just really encourage everybody to visit the berkshirepublichealth.co.uk website. A really good website now, lots of updated information. We also have a postcode checker. You can go in and put your postcode in to find out what tier you're in. And there's also a huge number of different languages that people can use as well if English isn't their first language, so they can look at what the restrictions mean for their local areas. If it's okay, Chair, I'm just going to talk a little bit about vaccinations.
Yeah, please.
Just an update on that. So it's just a few slides, just because the level of public interest in vaccinations. First thing I just want to say really is that vaccines don't necessarily give us a disease. What they do is they teach the body's immune system to recognise and fight the infection they have been designed to protect against. And many of you will know now that the Pfizer biotech COVID-19 vaccine was approved on the 2nd of December. So that's really good news and gives some light at the end of the tunnel, given how difficult the last few months have been. I really wanted to make the point, particularly with the Pfizer-BioNTech, that the vaccine has been subject to the same rigorous quality assurance process as all vaccines. So it hasn't skipped or been fast-tracked. It's been supported and followed the same rigorous methodology any other vaccine would do. And it's been approved through the Medicines and Healthcare Products Regulatory Agency. And that's a really important point to make. So all the safety checks have been undertaken with this vaccine. What we do know is the government has ordered 40 million doses of the vaccine, which is enough to vaccinate 20 million people. But what I think we have to recognise that it's going to take some time to vaccinate large numbers of the population. What we know is the vaccine is given in 2 doses, 21 days apart. So the second dose being a booster, and the immunity, whilst it does kick in after the first dose, it reaches its full effect 7 days after the second dose. So those people that will start to have the vaccination over the next month and months ahead, and I'll talk about that in a little while, it will still take some time for that immunity to kick in, and that will apply for those having a vaccination in the future. So where we are nationally and locally is that we know the government's identified 50 hospital hubs that have been chosen to serve as hubs for administering the vaccine. And the reason they've been identified as hubs, hospitals in particular, is because they have facilities to store the vaccine at -70 degrees. So that's one of the logistical challenges of the Pfizer vaccine, is it has to be stored at that temperature, and then distributing that vaccine can prove quite challenging as well. So that's why at the moment the hospital hubs are the place where it started, just purely because they have the facilities to do so. We know that NHS England are working hard with our GP practices and primary clinical networks to look at the local deployment of the vaccine in primary care. So again, as more availability comes through of the vaccine, we'll be looking to work with primary care to support those at-risk groups to make sure they get access to the vaccination first. As I said, it will take many months to vaccinate everyone. So while it's clearly positive news, you know, we know this is going to take some time. We know people still need to follow government guidance, hands, face and space, social distancing, but hopefully there'll be a much more improved position by spring, and hopefully by the summer, we're hoping that things will slowly start to return to normality. There are some outstanding questions in terms of this vaccine, so we're not quite sure how much protection the vaccine will give us. In terms of stopping people from spreading the virus, or how long immunity lasts. But what we do know is it does help people in terms of experiencing symptoms. And then the other vaccine we're really waiting for is the Oxford AstraZeneca vaccine, which is being developed by Oxford University, and that's currently being reviewed by the MHRA, and that doesn't have as much logistical challenge in terms of the storage of the vaccine, and I think the government's ordered in excess of around 100 million doses of that vaccine. So we wait to see the outcome of that review, but that will clearly change the position in terms of how quickly we can get vaccines out to the general population. In terms of the priority group, so there's a body called the Joint Committee on Vaccination and Immunisations, and what they do is they use the evidence to identify who should actually be prioritised for vaccination. So they've identified 9 different groups in terms of order who should get the vaccination first, top being residents in care home for older adults and their carers, and then second being over 80s frontline health and care staff. Questions might be asked in terms of why aren't we deploying the vaccine to the residents in care home for older adults and their carers, and that's largely down to the logistical operation of getting the Pfizer vaccine out to that population cohort. So I know that the government are working hard with partners to work out how they can do that. At the moment, they're focusing very much on the over 80s and frontline health and care staff, and that's really where the focus of attention is. That's all I've got to say on my presentation. Thanks, John.
Thanks, Matt. You then going to move on to testing? What?
Yeah, so that's me again. So it's another presentation. Apologies, but I thought it'd be really helpful to just go through a very quick overview about where testing is, because I think it is of public interest. So because there's been so many changes since the start of the pandemic in terms of how people can access the test, I just wanted to spend maybe 5 to 10 minutes just to take us through where the current position is and the different testing routes, and then I'm happy to take any questions after. So really, I'm just going to cover a little bit about up-to-date guidance, home testing, regional testing sites, the mobile testing sites, local testing sites, antibody testing, other testing, and then spend a little bit of time on natural flow tests. So really, the testing is still free to anyone that needs to get it, and the key symptoms are the driver for that. So if you have a high temperature, a new continuous cough, a loss or change in sense of smell or taste, any of these symptoms, then it's really important when people book a test. We know from national evidence that sometimes people get one of these 3 symptoms, they don't always seek a test. It's really important. We know there's plenty of capacity in our testing stations now, particularly at Newbury Showground. So really important you get a test. It's also important to note you don't have to have all 3 symptoms. Sometimes we've heard reports that people think they have to have all 3 before they get a test or think they might have COVID. It's literally any one of those 3 tests, symptoms, and that's really important. However, people can also get a test if they are asked by a local council, so as ourselves. If we direct a member of the public to get a test, then they can get a test, and there is that ability to tick that box on the website. And they can also be asked by a local hospital, for example, in terms of having an operation. And also those that are taking part in a government pilot project can also seek a test. So really, this is just a very simple diagram just showing the process really of getting a test. So people can book for a COVID test, or they can order a COVID test for home. And there's 2 pillar testing we often refer to in the Outbreak Engagement Board. Pillar 1 is those tests conducted within a hospital, and pillar 2 are those contested in a regional testing site, a mobile testing site. And they go through laboratory testing, and then that goes into the test and trace. And I won't go through that into detail, but there's 2 routes. What happens is somebody would either be contacted through the NHS test and trace service, or they get tested by Public Health England, depending on the complexity of the setting that they're in. So in terms of the home testing kits, so these can be ordered online. They're delivered to the resident's door, so they can test themselves and their family without leaving their house. And again, for those people that don't have transport, or they can't access go to a testing site, then obviously it's just easy for them to do that online. And they normally get the test done within 7 days of symptoms starting. Obviously, we're really fortunate here in West Berkshire to have a regional testing sites. Not many local authorities have these facilities on their doorstep. So these are large testing sites, up to 800 people can be tested each day. And they're strategically located across the country so that no one has to drive more than 45 minutes to a testing site. So the majority of the population, as I said, shouldn't really drive more than 45 minutes to get to one of these sites. They're normally drive-throughs, but there are some walk-ins or hybrids that cater for different individuals, but we don't have that facility, and they're run by a private company on behalf of the Department of Health and Social Care. In terms of mobile testing units, I think the key point for this is that we do have mobile testing units that visit Hungerford and Thatcham. People would only notice the difference if they were booking a test online, and then they would see that option appear in front of them. So if they were having COVID symptoms, they went online, and sometimes they might see the option of going to Hungerford or Thatcham. And again, these are just really, as I said, mobile testing units. People can just turn up and they can get their test. The local testing sites, we don't have any of these in West Berkshire at the moment, but these are very much kind of a walk-through model. They have them in Reading, and we are looking at setting more up across West Berkshire, but they're kind of fixed locations that provide places of high population density that can be set up for 3 months and can accommodate between 180 to 324 tests per day. I won't spend too much time talking about antibody testing. Again, these aren't widely available yet. They're mainly being used for people working in certain roles, such as primary care, social care, but they're mainly being used to help the NHS and scientists learn more about what who has already had the virus and how it's spread in the UK. The other types of testing we have available is satellite testing sites. So Berkshire Healthcare Foundation site have a testing site for some of their staff. Care homes receive testing kits weekly for the staff, and they also can test their residents every 28 days. And we know all our schools also have about 10 testing kits, and these are mainly for people who have significant barriers to getting access to a test. General practice since the beginning of November can now order up to 40 swab testing kits per week, and universities can also get access to some testing. So it's a significant expansion of testing over the last few months. Finally, I just want to say a little bit about the community testing. So this is, again, something you would have heard a lot about in the news, and this is very much about identifying asymptomatic people, so people that don't have symptoms or don't know they have COVID, to isolate them and their contacts. And really the aim of this testing is to control an outbreak or community transmission by getting everyone who tests positive to isolate without without stricter broad COVID-19 control measures. So hopefully to avoid any more national restrictions going forward. There's been one lateral flow testing device which has been approved, which is being rolled out across the country, and I'll talk a little bit about that in a minute. And there's key national work streams they're looking at, so how they can get people to regularly test NHS staff by using these lateral flow device kits in universities, in prisons, care home visiting, and DPH, Director of Public Health-led community programs. So how do lateral flow tests work? So they don't require lab processing, and therefore they can return a result much quicker than PCR tests. So similar to PCR, the sample gets taken from the patient's throat and nose with a swab. The swab is added to a liquid and mixed to a release sample from swab. The sample of liquid is placed on the end of a pad. The liquid is drawn along the pad via capillary action, and then a strip on the pad is coated in materials which binds the virus to proteins. And then it presents a second line will show if somebody has COVID-19. So it's very much like pregnancy tests. Some of the key things we just need to be aware of in terms of the lateral flow test is that they don't require lab processing. So as I said, they can return a much quicker result. And it is a one piece of a testing kit that can enable community testing to be added to the COVID-19 control measure, so it can be quickly deployed. And I said it's called a lateral flow test because it rapidly detects parts of the coronavirus itself. However, I think it's really important to say this is not a quick version of the PCR test, and the PCR test is the test that you would currently have as a home testing kit or the newbie showground. What we know is some of the evidence to date is that it can correctly identify 90% of infected people if they have a high levels of the virus in their body, but only 60 to 70% overall. And what that means is people who are highly infectious, they have a high viral load. And what the laboratory studies have shown is that actually it can identify a high number of these individuals, which is good because we know those people tend to be highly infectious. But what we've started to see in Liverpool is compared to PCR tests, these tests picked up only 5 out of 10 of the cases, and more than 7 out of 10 cases with high viral loads. So it doesn't necessarily perform as well out in the field, which is something we need to think about going forward in terms of how we would look to deploy lateral flow tests. So the final slide really in terms of what our local implementation might look like in West Berkshire with these lateral flow tests. So testing seen on the scale in Liverpool is unlikely to be replicated in areas that are in tier 1 and tier 2. So at the moment, the scale that was undertaken in Liverpool is very much being looked at in terms of areas in tier 3. We continue to await further evidence and data to inform what this could look like in West Berkshire. And what we're doing is working with our neighbouring local authorities to pilot and evaluate community testing in high risk groups. So those groups we know that are more susceptible of getting COVID, but to also support local outbreaks. The government have also written to care homes as well recently to arrange the deployment of LFT kits in care homes. So we'll be working very closely with our care homes to support them and guide them about how they can go about using them. The key thing for me is about how this does actually influence behaviour in terms of testing is just one part of a repertoire of tools that are disposal, if you like, about how we control the pandemic. And it's really important that people act on the result they get. But the communication of that result is really important. Obviously, somebody testing negative with one of these devices is just that result at that moment in time. And clearly there's a risk that they could get COVID the next day or the day after that. So it's really important how we actually communicate what the results of these tests mean to the general population. That's my presentation. Happy to take any questions.
I think you're being let off lightly, Matt. I can't see any blue hands up there at all.
I think so. Too much PowerPoint, I think.
Absolutely. So perhaps we can move on to Martin to deal with communications.
Thank you, Chair. So I know at the last meeting was discussed in particular the plan for communicating the messages around Christmas and the Christmas bubble, which have been announced, and this is something that we've been looking at as a communications team and have some plans for. Our focus last week was really around the change in the tiers, the move from the move out of lockdown into tier 2, and really sort of communicating to residents what that meant for them and what they could do. We've started doing some work around Christmas, and we're going to be building on that over the coming weeks. So some of the things we're beginning to look at doing for that, we're developing some posters which can go out into local communities with that messaging on. We're beginning to share it in the newsletters that go out to residents. We've got about 40,000 subscribers to that newsletter, so we're still doing really well with that. We're developing some social media graphics as well, just to begin sharing those messages not only on our own channels but on community forums too. Importantly, we're looking to get those messages translated into key languages, secondary languages also. Just to make sure that we're serving that message up to as many different communities as we can. We're looking also at doing a Facebook Live between now and Christmas, so that we can talk to residents and answer any questions that they've got in respect of what they can and can't do over Christmas. In the run up to Christmas, we're also doing some work with schools, particularly around social distancing and staying safe at the school gates, because we know that's an area where we've had some feedback that social distancing isn't perhaps happening as well as it could. So we've got posters going out on school gates. We've got content which we're sharing with schools for them to put in newsletters and go out to parents. In the new year, we're also looking at developing some banners which can go out in front of schools and provide a much more visible reminder about what we're asking of parents when they are at the school gates. In the run up to Christmas, we are also working across Berkshire, sort of through Public Health for Berkshire, on some animations and some other campaign work, which will help us get important messages out. They're looking at sort of three key areas. One is around showing how COVID can spread and enter houses. So what you can do to make sure that you do as much as you can to prevent COVID from getting into your home. We're going to be doing some video with young people and asking them to hold placards which say "I do" on them, and then it's going to flip over to the other side with some other important key messages on. So I do protect others, for example, just to bring our communities involved, get them spreading the message, and hopefully appeal to young people in particular. For that, we're also going to be doing some work with young medical professionals about their experiences treating people with COVID, just as a reminder about the need to do all you can to prevent it being passed on, and actually sort of remind people that it's a real virus, and actually we need all need to be doing as much as we can for that. So I've spoken about schools. We're continuing to work with businesses as well to promote the work that they've been doing to make sure they're open and trading in a COVID secure manner. We want people to stay safe when they're out and about on the high streets, and to be able to shop with confidence. So we've got a series of videos that we've produced and will be sharing between now and Christmas with local businesses, talking about the work that they've been doing to be COVID secure. So Cobb's Farm Shop in Englefield is one that we've been working with, the Avenue Deli in Cowcott, and the Vineyard also we have to come. And then in summary, some of the other activities that we've been doing, we're continuing to promote the local contact tracing work. We've released last week a video which talks a bit more about contact tracing, what happens, what the contact tracing team does, and what you can expect if you get a call from one of those teams. We're continuing to push out the general flu messaging, which remains just as important as it ever was this autumn. And of course, we're continuing to provide comm support to the incident management teams, as and when they're formed and require support. So it continues to be a busy time, lots of messages to get out to our communities. The team continues to be working very hard to get all of those different messages out to our communities in as simple a way as possible. And I think going into Christmas, through that into the new year, looking at the communications around vaccination and testing, it will continue to be a busy time for a little while yet.
Thanks, Martin. Any questions of Martin? Any suggestions for items which might be included for the agenda in 2 weeks' time? I personally would quite like to see, I thought the school one we had 2 weeks ago was very successful. I wouldn't mind trying to see if we can find something similar. Perhaps, depending on what happens next week, perhaps something in the hospitality industry might be an idea, but we can work on that. Do I have any other business? In which case, I think
I did put my hand up.
I missed that one. I'm sorry, Graham.
I was going to go back to your matters for agenda. Hopefully, within the next fortnight, we'll have a better idea about lateral flow tests and where that whole piece of work is going. And that obviously, in my area, impacts the care homes, and we need to look at the visiting policy and what messages we, both as a provider and as an important element within the market, the messaging we want to get out to the market about lateral flow tests, and in particular the concerns that I think the message, hopefully Matt and Andy may want to come in on this, the message that seems to be going out is that if you've gone through the lateral flow test process within a care home and been shown negative, you can go and hug your relatives. I think we're a little cautious about that. I think I want to get that, and I do want to get that message out to the public generally, and the relations of those in care homes particularly, because I don't want the message to be, you get a negative test and it's okay to go and hug and kiss your elderly relative in a care home. I don't think that's the message we want to send, but I'll defer to Andy and Matt on that one.
Andy.
Thank you, Chair. Absolutely agree with everything that Graham just said. I think we're being very cautious about the use of the lateral flow test to support visits to care homes. There is a pilot ongoing in Woking at the moment, so obviously we'll be reviewing the findings of how that works there. And the intention is to take a paper through our processes over the course of the next couple of weeks, look at how that impacts on how we manage the process. But as Matt said in his presentation, of course, you can become infected with COVID the day after you test or very quickly after a test. So we need to be careful about how we use them and people's perceptions around it. So it's an important point, because obviously people in care homes are the most vulnerable. So we need to make sure we're very careful about how we use the test results.
Anyone else want to comment? Any other business again? No? In that case, I think that concludes all the business. Thank you for attending, and in particular members of the public. I wish you all a pleasant evening and close the meeting.